In terms of health education, in view of the challenges related to donor funding withdrawal, maybe I'll give a background that the City Health operates 10 health facilities, 4 polyclinics, 5 satellite clinics, 1 infectious disease hospital, community IDH, Ascot Stadium there. The services that are offered in these 10 health facilities are related to TB, HIV testing and counseling, RT, opportunistic infection services, family planning, antenatal care, postnatal care, deliveries and maternity, EPI, and mental health. After the announcement of the withdrawal of donor funding by the United States of America, we had technical partners like ZHL, FHI360, PSI for HIV or AIDS on testing and treatment basis. We surely had a big funding gap because we were receiving assistance from these technical partners. They were helping on the 95 HIV AIDS program. I'm sure you're aware of it, where we say 95% of people who are living with HIV or AIDS, they should know their status, they should be tested, they should be put on treatment, and by 2030, 95% of those, they should have a viral suppression because of taking the medication. So these technical partners were helping on that program. So since that announcement, 90% of our technical partners have withdrawn since the US announcement of withdrawal of the global aid fund. So they have since closed the shop and we are on our own. So what is the impact? The impact is definitely there has been some financial strain because that announcement alone resulted in 20% of World Health Organization's funding being withdrawn in terms of assisting in disease eradication and pandemic preparedness. So the other thing that is also happened because of that announcement is expertise gap, because there's loss of collaboration with the with these other international organizations that work in the health sector, like the US Center for Disease Prevention. It means also their assistance is going to be reduced. There's been also loss of staff. For example, to be specific with your city, Zimbabwe Health Interventions, ZHI, was funding 8 registered general nurses, 6 primary care counselors that were working in the 10 health facilities that I mentioned. These have since been terminated. They've been withdrawn because their contracts with the ZHI were also terminated. So it created a gap. So we did a gap analysis as the city, and we saw that we now have 11 out of 28 are registered general nurses, which means we have got a vacancy of 17. So those 8 were kind of alleviating that gap, closing that gap. So we have got 17 vacancies of RGN. In terms of midwives, we now have 47 out of 75, which means we've got 28 vacancies that are there. So that is the gap that has been created by the withdrawal of that aid. So in terms of interventions, on the 11th of March 2025, your council sat down. We had an ordinary council on the 11th of March 2025, that is last week, Tuesday, if I'm not mistaken. And the council resolved to recruit 10 registered general nurses, 16 midwives, and these are going to be funded through budget virements. What we call a virement is that the 2025 approved budget that we are talking about today, yet some allocations for some other things. So what happened is that council sat down and then we had to prioritize and say of these 2 or of these other interventions that are in the budget, which are some of the critical areas and in fact, let me not use the word non-critical areas, less critical areas. Then you are then moving money from those less critical areas in courts to then try to bridge the gap that has been created by the withdrawal of donor aid or donor funding. So that is what we call budget development. You are still working within the 50.4 million budget, but you are now reducing concentration of funds from one area and moving it to the health and education sector. So what Council did was to identify some, in terms of the recruitment, the employment budget, what Council had to did was to identify some budgeted vacant posts that we then rated as less critical, and those are not going to be filled in 2025. What it means is when you were talking about the flooding that happens within the central business district when it rains, and you wanted to clear some of the, what do we call them? To clear my drainage. We then say maybe if you wanted to recruit 40 general hands, maybe we're now going to recruit 10, and the money equivalent for the 30 general hands we then channel it probably towards health. That is what we call budget development. So we identified such posts that we deemed less critical, and so which means in the 2025 budget we are no longer going to fill those posts in favor of the health gaps. So we now close the gap for the aid that has been withdrawn. So this is what we've done in light of the withdrawal of aid, to say we've gone into the budget, we've identified some projects, we've identified vacancies that were there, and then we are cutting spending across the divide so that we unlock a few dollars that we can now use to deal with our health issues. As regards the issue to do with antiretroviral drugs, I'm sure the government is on record that they started mobilizing those. I'm sure they will still continue to supply our clinics with those so that we can also pass it on to those who are on ART. But in terms of the council budget, we do not have a provision to procure those on our own. We are waiting for central government to do that, and the central government has said, don't lose your sleep, go and sleep well. It is taking care of that. So there's no need to panic. Going forward, we are also going to realign our budget. Now that we know that there's no aid that is coming, we are looking into our own internal growth vectors and see how we can unlock those to make sure that we generate enough revenues to meet most of the things that previously were funded under the donor sector.